Maine is, of course, the oldest state in the nation, so there's no lack of older adults to take care of.
We're a tertiary care center. All the complicated cases come here, and by extension, they go to our nursing homes. They have the hardest dementia cases that are being taken care of by our psychiatrists, our neurologists.
We've had a very unique opportunity to kind of really expand our program in geriatric services.
All of that kind of interest in older adults, interest in academics, interest in our fellows is really what makes this program unique.
The fellowship in geriatrics in general, I feel like is like a hidden gem.
Because we're a small program, there's really the ability to have a broad experience, but also tailor the experience so that it can really meet the individual's needs.
Through this fellowship, you would have exposure to so many different ways that you can practice geriatrics medicine.
To kind of give you a flavor of all the different areas, there's the Geriatric Center, which does outpatient geriatric consults.
I'm able to help the fellow kind of develop as the year goes on and create experiences to help them continue to grow as a clinician, but also keeping in mind what they're going to want to do when they leave fellowship.
There's outpatient consults, there's inpatient consults, there's nursing home work.
We actually have a assisted living continuity experience, a post-acute and long-term care facility.
They have their own patient panel. It's a mixture of long-term care and rehab patients, and they're primarily responsible for the care of those residents.
And that is actually one of the gems of our program.
There is home visit programs, there's hospice programs, there's primary care.
Inpatient psychiatry for 2 months. We do New England rehab where fellows can work with a physiatrist.
Part of the year was longitudinal, so I would do the same things every week, long-term care, geriatrics, and working at the Geri Center with dementia patients. And that was where I was really working one-on-one with these mentors over the course of the whole year.
One-on-one time really allows you to be able to get your needs met at the highest level from a learner.
And then every month I would do a different type of clinical experience.
We actually have something unique, which is a rural geriatric medicine block. And they get to understand really what it's like to work in a resource-poor environment.
You really get a very diverse experience over the year of their fellowship.
I really liked the flow because I got to see different things to keep things interesting and keep me learning, but then also got the longitudinal experience I needed.
For me, choosing something has always come down to personalities, and I love the people that I work with.
They care about geriatrics, they care about our fellows, and they're truly invested.
You're not always going to be at work, and it's really important that you be in a place where you're going to enjoy your time there.
Such a great place to live. It has everything the big city has except the headaches, the traffic.
Where else can you see the ocean from some of the rooms in the hospital? Where else can you see a beautiful rural setting as you drive to your daily work?
And I really love this place and the people I work with and the patients I serve.
So I actually got married right there. My group is amazing. One of them was my maid of honor, another one was one of my bridesmaids.
Working in the greater Portland area is just great.
It's just a wonderful place with a great quality of life.
I would say that if you're considering coming to Maine Medical Center, then you should do it. You have the work component of why you should come, and then the lifestyle component of why you should come. And on top of all that, you're going to get a phenomenal education.
Our fellowship's honest desire to be the best. You know, we may be small, but we have it. I've gone to national meetings, and the stuff we do here is the top notch that you see anywhere else in the country. Plus, as I said, I think we're a little bit happier here because of the quality of life.
I work with some of the best people, and I think that if you come here for training, you're going to work with some really amazing people, and I don't think you'll regret it.